support now from the CDC to help to man the lines. I think we had some issues with persons and the extended period. Of course, they spend between up to about 10 minutes, 15 minutes sometimes with the caller asking questions. A lot of people were seeking information, but some persons were actually indicating that they either themselves have signs, cough or a respiratory symptom or so on. Lots of time we would, through the questionnaire, we'll determine that that person doesn't fall into a group of high risk, and we'll direct them to services. Or we have a clinician also there who can speak with them further to ascertain what their risks are. So it's a continuous risk assessment program.
Does the hotline operate 24 hours?
So far we're trying, and with the assistance from the Civil Defense Commission, we were able to expand the time which this hotline is in operation to ensure that we can provide a high quality service to members of the public. I guess people are probably tired of me saying wash your hands, wash your hands, wash your hands, wash your hands as often as you can, as thoroughly as you can. Hand sanitizers are also very effective. We understand that some of the sanitizers may not be adequate in the sense that we're saying at least 60% alcohol based. Some might just be, a soapy solution or gel or something. So please read the labels, make sure that they are meeting the requirements as the ministry sets out. Alcohol is also very good. If you're disinfecting, we can use alcohol and that's what we're using to spray any contaminated areas, the vehicles, and so a solution of 70% alcohol. All right, some of the disinfectants work, some may not, depending on what the efficacy is. A lot of antibacterial might not be effective against the coronavirus. Good soap and water, liquid soap preferably, does a great job. Sunlight, exposing any possibly contaminated materials like bed linens and so on to direct sunlight seems to be very effective. All right, so those are some of the things. Some of the myths, I think we still need to be, even though globally we haven't seen a lot of children, for example, and maybe pregnant mothers affected, we still have to be cautious, because we're in the early stages of an infectious disease. We don't know what the medium and long-term impact will be, whether this infection might be fleeting in younger people, healthy people, but you don't know if there might be any sequel that we have to look out for. So, caution all around is so important. For members of the public, it's not a time to point a finger, make an accusation, or stigmatize or discriminate against anyone. I think it's time for us to help each other. All right, there are some social distancing. We are promoting this. The schools have all been closed. We keep saying through various forms, the Ministry of Education is providing support for the families at home. I think even in the public service, they have a rotation basis for staff working. They're given time off to spend with their children, ensure that they can still continue to learn even though they're at home, do their lessons, the ones that are provided on the learning channel, or even those that are emailed or sent out. I think some of the private schools have started to send out their lessons for the daily subjects that they would do online too. You can follow that up, and there are lots of materials out there they can read, they can learn. I'm advocating that let the children go outside in the sunlight, not in big groups, maybe just go out and play a little bit, have a bit of sunlight, open the homes, aerate them properly, clean and sanitize all the surfaces. Make sure you look at food safety too. All right, even though it's not at this point a major way of transmitting, WHO still indicate that food safety is a concern and should be addressed. Eat foods that are prepared within 2 hours, warm. If you have to store and reheat properly before consuming, and dispose of all contaminated materials carefully.